All right, 19.10 is about, let me get my pointer here, is about vitamins. There are two types of vitamins. There are fat-soluble vitamins and water-soluble vitamins. All right, vitamins are organic compounds. They require small quantities for normal metabolism and must be obtained from our diets. There are water-soluble and fat-soluble. Water-soluble, you cannot really overdose on water-soluble. If you just take a lot of it, you'll just excrete it out. But fat-soluble ones, you can kind of take a little bit, like way too much of fat-soluble vitamins. But the four main ones are A, D, E, and K. We hear a lot about these in the news, like D especially. But they come from fruits and vegetables, like A, for example, comes from beta carotene, which we'll see in the next slide. Um, and a lot of the other ones come from fish and liver and from like dairy products. They are stored in our adipose cells because they are fat soluble um, vitamins. So here's vitamin A. It comes from, like I said, from beta carotene. What beta carotene is imagine two of vitamin A molecules, another one on this side, hooked on this side, and exactly the same thing. So what our bodies do is they slice this molecule in half and they put an alcohol group on the end of it. All right, and it's very good for our vision as well as for our mucous membranes. All right, a deficiency in A can cause night blindness and dry eyes and skin. Vitamin D actually helps in the synthesis of cholesterol. You can kind of see, so you remember cholesterol is at 6665 ring system. You can kind of see here's one of the sixes, here's the six attached to the five, and then if you were to spin this molecule around that bond, so this carbon group is closer onto that carbon, you can see how that would be a six-membered ring if this carbon hooked onto there. So one, two, three, four, five, six. So by taking vitamin D, it's pretty close to the structure of cholesterol already. All right. It can be obtained from diets such as milk and regulates calcium, potassium. A deficiency in D causes rickets, which I really don't believe is really a problem nowadays. Vitamin E is an oxidant, meaning it protects us from oxidizing agents or from free radicals. Um, there are numerous problems with a deficiency of vitamin E. And finally, vitamin K helps in the synthesis of clotting, and it can lead to fatal bleeding. All right, the last group are what we call prostaglandins and leukotrienes. Um, these are not stored in cells, but they are synthesized in response. All right, unlike hormones, they are local mediators, um, performing their function in the environment at which they happened. All right, prostaglandins is kind of what these molecules are. You've probably heard of prostaglandins. Um, they are carboxylic acids that contain five-membered rings and have a wide range of activities. They have these common structures. It's a five-membered ring and usually have four groups hanging off of them. Two of them are alcohol or are oxygen containing groups, and then you have two others which are very long chains of carbons. All right, they are responsible for the inflammatory response. When you hit your knee or hit your arm or something and starts swelling up, usually it's prostaglandins are going into the site. And what aspirin and ibuprofen do is they relieve the inflammation by blocking the synthesis of prostaglandins. All right. They also prostaglandins also decrease the amount of acid that is produced in our stomach as well as the mucus inside of our stomach. That's why in taking a lot of aspirin and ibuprofen, sometimes it can cause an ulcer because it stops the production um, of uh, of um, of all the mucus inside our stomachs. Also inhibits platelets. That's why aspirin sometimes is they are given to patients who are having heart issues. They want to thin out the blood. Um, so that's kind of what aspirin does. It blocks the synthesis of prostaglandins, which is responsible for our blood platelets. There are two types. There's a COX-1 and a COX-2. Um, COX-1 is involved in the production of prostaglandins, where COX-2 is responsible for additional prostaglandins, um, like the inflammatory response in arthritis. Um, non-steroid, non-steroidal anti-inflammatory drugs, like aspirin, ibuprofen, inactivate COX-1 and COX-2. That's why it causes the risk of ulcers. However, there are drugs now that just block um, like the COX-2 enzyme without affecting um, um, the the production of the mucus inside our stomachs. Asthma is also another issue of inflammation, particularly inflammation in the lungs. And by using an inhaled steroid, it reduces the inflammation. All right. So leukotrienes are molecules that contribute to the asthmatic response by constricting the smooth muscle in the lungs. All right. So there are new drugs that block the synthesis of the leukotriene that treats the disease, not just the inflammation response like an inhaler. All right, so that is it for this chapter. If you have any questions, please ask in class.